All right, let's look at vaccines now. Aspen says it plans to stop producing COVID-19 vaccines in Gqeberha. Demand for the vaccines has dried up despite COVID-19 cases rising in South Africa. Aspen currently has an agreement with Johnson & Johnson to package and fill vials of the American company's vaccine. It is the only health company producing COVID-19 vaccines on this continent. To discuss, we're joined by Senior Executive for Strategic Trade at Aspen, that's Stavros Nicolaou. Stavros, thank you for being with us. When South Africa was crying out for vaccines, did you ever think we'd reach this point?
Francis, firstly, good evening, and thanks very much for having me back again. No, if you had asked me even 3 or 4 months ago would we be in this position, I would say it would be inconceivable. But moreover, we should never forget where we were 18 months ago when there was this frenzied scramble for vaccines globally and Africa was left at the back end of the queue. And I think therein lies the real risk here, Francis. If we don't secure orders for the Aspen Gqeberha production lines for COVID vaccine orders, then unfortunately there's a real risk that we lose this capacity for the continent. We're nowhere near out of the woods yet with this pandemic. We don't know what trajectory it will follow in the following or ensuing months. And it would be tragic for the continent if we lose this capacity and return to the back end of the queue again where we were 18 months ago.
Okay, so you can't keep your facility open out of goodwill, is what you're saying?
So, Francis, it's actually not a facility. It's production lines. And I think it's a really important point to make. So Aspen has many factories at its Gqeberha site. One of those is a sterile facility. And we repurposed, because of public health emergency calls, we repurposed 2 of our production lines where we would have made anesthetics. We repurposed those to manufacture COVID vaccines. Now, you can't sustain those lines vacant indefinitely. And unless and until you get orders, you're going to have to possibly look at repurposing back to making anesthetics, but then you lose that capacity, as I said, for the continent.
And I mean, we're entering potentially a 5th wave, so you're not convinced that the orders will come back, even though that's happening? Is that because of vaccine hesitancy or the fact that the disease isn't as fatal as it was?
Francis, those are all excellent questions, and there's a multitude of responses. Let me just highlight 1 or 2 that I think are relevant for this conversation. I think, firstly, there's no doubt that there is a significant element of complacency. Some people are calling it a new pandemic, vaccine complacency, or COVID complacency, actually. So it's going to require a reignition of political will on the continent again by the heads of states, by the health ministers. Africa is only 18% vaccinated. It set itself a target of 70%. So there's got to be a renewed call to start vaccinating aggressively again on the continent. Vaccines have proven the world over to have significantly reduced COVID mortality, and there can only be immense benefits to reigniting that call again for the continent to aggressively vaccinate. The second and final thing, which is really important, and I want to highlight this, the procurement happens through multilateral global procurement agencies. And these agencies need to start procuring from Africa. Up to date, not a single dose of African-produced COVID vaccine has been procured by any of these procurement agencies. Billions of doses have been procured globally, as you know, significant quantities from India and China and other parts of the world, but nothing out of our continent as yet. So there's got to be a strong call for a change in the procurement dynamics and the way procurement is conducted globally, so that the continent manufactures for itself and it doesn't have dependency on others.
So that is very interesting. Does that mean there's a lack of trust in Aspen or in Africa? I mean, can't Johnson & Johnson use its sway to change that procurement outcome at the moment?
Well, there can't be a lack of trust in Aspen or anybody else for that matter on the continent, because we've already produced for and on behalf of Johnson & Johnson 180 million doses. And those doses have gone largely to Africa, but some of them went to Europe. And there's no better test of your quality systems than if you are supplying a vaccine that you've produced for and on behalf of Johnson & Johnson. You have they're a massive multinational organization globally, so there can be no better test of one's confidence than Johnson & Johnson procuring from you. So the fault lines here reside with the procurement mechanisms, and those are unfortunately outdated. They need to become more localized and relevant to specific continents, and I think that's the change that needs to happen here.
All right, so the health department said that it's trying to persuade you as Aspen to reconsider. The president has said that he will be speaking to other heads of state. So there is a scramble going on. What is the time frame? How long will you wait to receive orders before shutting down these production lines?
Francis, look, there are a lot of discussions that are going on at the moment, but I think it would have been irresponsible for Aspen. In fact, Aspen didn't raise this in the first instance. The Africa CDC, in the form of its director, John Gqeberha, was doing a responsible thing. He raised the alarm bells here a few weeks back, and he said, if there are no orders, we're not going to sustain any capacity, whether it's Aspen's capacity or any future capacity on the continent. So I think the responsible thing is to raise the alarm bells. We've done that. There are a number of discussions happening. Of course, we're most appreciative of the support that the African Union and the African heads of state, including our own President Ramaphosa, are making. But at the end of the day, the people that need to be convinced are the procurers. And I'm hoping that through all of these discussions, a plan can be made, even if it means staggered orders. So you have a small order now and you stagger the rest. What we don't want to happen or see happening on the continent is that we lose this capacity. We have to repurpose it back into anesthetics or other things, and then this capacity is lost once and for all to the continent. The continent simply cannot afford that. Yeah. We should be reducing our import bias, not increasing it.
Finally, I mean, there was even this wonderful plan that you would produce a local COVID-19 vaccine, obviously the IP from Johnson & Johnson, but it would be repackaged. I think it was called Aspenovax. So is that all on hold right now?
So it's exactly Aspenovax that we're referring to, Francis. We've got two arrangements with J&J. I've referred to the first one, which is a contract manufacturing arrangement. We've produced 180 million doses of that. But the second arrangement is the one that we are referring to here, which is Aspenovax. It's an African vaccine produced in Africa for Africa, and not a single order or dose has been produced for procurement as yet.
Sure, incredible. Thank you for that, and we'll follow those efforts to bring in the orders to make sure that this capacity is not lost. That was Stavros Nicolaou of Aspen Pharmacare Holdings.